Hello, for my presentation, I am going to talk about children that have cerebral palsy and ADHD. What is cerebral palsy? Cerebral palsy guide shows that 1 in 345 children in the United States are diagnosed with it. Every year, approximately up to 10,000 babies could be diagnosed with cerebral palsy later in childhood. 1,500 more children will be diagnosed with cerebral palsy. Symptoms. If a baby is born with a birth complication called hypoxic ischemic encephalopathy, they are more likely to develop cerebral palsy. Other symptoms for parents to look for is the way how the child moves, responds, and develops, which would be different to other children in the same age group. Some babies could be stiff or rigid, while others may feel overly floppy or have trouble controlling their movements. Other early symptoms for parents to look for in cerebral palsy is developmental delays. This could be if the child is having a hard time rolling over, sitting up, or holding the head steady. Treatment and medication. Children that have cerebral palsy can have a variety of medications to treat them. Some medications could be short-term, while some medications could be long-term. These medications are anticholinergics, which is to help reduce uncontrolled movements, anticonvulsants, which is to control seizures, antidepressants, which is to lessen symptoms of anxiety and depression. Anti-inflammatories is for muscle pain. Baclofen is to reduce muscle tightness. There are many types of cerebral palsy. Children that have spastic cerebral palsy can get in a lot of pain. Children that have anti-toid cerebral palsy, which is low muscle tone and involuntary movement, doctors prescribe anticholinergic drugs which help ease the symptoms and block the nerve impulses and to stop drooling. Barbiturates and benzodiazepines are medications given to children with cerebral palsy that have seizures. Physical therapy. Physical therapy helps children gain strength, gross motor skills, and with their mobility. Physical therapy is keeping the child's posture, sensory processing, muscle tone, coordination, developmental skills, and adaptive equipment. This can strengthen muscles, increase range of motion, and improve balance. Common physical therapy treatments are resistance, strength training, functional balance training, and coordination exercises. Occupational therapy. Occupational therapy helps children with muscle tone, eye-hand coordination, visual perceptual skills, and sensory processing skills. During occupational therapy, a lot of adaptive equipment and assistive technology to help their independence so that they do tasks on their own. Examples of adaptive equipment are feeding utensils, switches to help the child access computer devices and electronics, adaptive scissors, writing utensils, splints, and in clothing like the zipper pulls and button hooks. Differentiation instruction. Teachers can make teaching modifications for children with cerebral palsy to help them engage and be successful in school by breaking down the task into manageable steps, providing extended time during activities, making instructions clear and brief for cerebral palsy students using frequent repetition, pair verbal instruction during instructional time with visual or tactile cues, seating arrangements for cerebral palsy students to support physical comfort and visual access. Process differentiation. Process differentiation. Process process differentiation. Teachers can help students with cerebral palsy feel more included in the classroom by calling their names during classroom discussions and activities, giving the child a leadership position by letting students have small structured group activities, flexible choices for showing work, orally participating in lessons instead of writing. Product differentiation. Students with cerebral palsy can have a hard time writing when doing assignments. Students can do work on computer or tablet devices. Teachers should use a lot of communication when they teach and use a lot of pictures when having verbal story or act out the story. During math instruction, teachers should let students use laptop with an adaptive keyboard and math activity online for students. Teachers should let Teachers should use a lot of technology and assistive devices. Teachers should provide online homework for students. Positive behavior strategies. Teachers can support students with cerebral palsy by having routines and a visual schedule. Positive and using positive reinforcement. This is important so that children can be aware of activities and be introduced to new activities. This is good because it will prevent the children from having negative behaviors. Strategies to help children with that have cerebral palsy is that teachers should set boundaries in the classroom with the students. Teachers should promote positive reinforcement so that the child has appropriate behavior. This could be positive feedback for the child from the teachers. If the child is just class, the teacher should give the student time out for 1 minute. Technology. In schools, there are a variety of technology to help children with cerebral palsy be successful in school. That is vision aids. These are magnifying sheets to help students with reading and to be used in text-to-speech program on computer devices. These programs can read text aloud to students that have hearing problems. Communication devices are helpful to students with cerebral palsy because these devices help choose words, letters, and pictures. ADHD. According to the CDC, Approximately 7 million children that live in the United States that age from 3 to 17 years old are diagnosed with ADHD, which is about 11.4%. Symptoms are hard time with inattention, hyperactivity, and impulsiveness. They make a lot of mistakes, have a hard time with putting things in detail. The child does not follow directions. The child is easily distracted. The child is often forgettable. The child has a hard time organizing. Treatment and medications. Treatment and medications. The treatment of for children for ADHD is behavior therapy or medications. Depending on the age of the child, it determines how much medication and behavior therapy they should have. If the child is 6 years old or younger, it is recommended that they receive behavior therapy as first line treatment. If the child is 6 years and older, pediatricians recommend that they receive behavior therapy and medication together. Differentiation instruction. According to the CDC, children with ADHD should have extra time on exams, accommodation for assignments, positive reinforcement, access to technology to assist with tasks, movement breaks, less distractions in the classroom. Process differentiation is that students need to work in steps and follow a schedule to stay organized. Students need frequent breaks. Students need assignments done in small steps. Students should have flexible seating. Minimize this, and students should minimize distractions in the classroom. Behavior strategies. Children with ADHD who have a hard time listening and following directions in the classroom could be challenging. Teachers can use a positive behavior chart system for students. The positive behavior chart is important because it sets behavior goals and rewards for the student. That can be, teachers can also use flow charts and they could use timers. This system is very beneficial for the child because it focuses on how they are performing rather than staying a negative report. This will give the student better self-esteem so that they can always want to have good behavior in school. Technology. Technology. Technology, the teacher can use noise canceling headphones and earplugs. Students should use a lot of reminders, visual, digital schedule or timer, or to let them know the next activity. Audiobooks, voice recognition software, speech synthesizers, and screen ready systems. Screen magnifier, electronic worksheets, and portable word processor. And these are my references. And that's